Hello, I'm Anne Marie Gattari, your host of Aging Well in America. Every day, up to 10,000 people turn 65 years old in the United States. 5.5 million people today are aged 85 or older. By the year 2050, that number will grow to 20. 20 million people will be aged 85 or older. Are we ready? Is America ready? There's so much good work going on around the country right now, around the world, and right here in our own community. And we have with us today one of the people who is doing some of that good work. Her name is Kelly. Kelly, your last name, pronounce it for me.
DeLisi.
Kelly DeLisi from Great Lakes Caring. Hospice, palliative care agency, as well as Medicare home health care, correct?
Right.
So, and you specifically are on the home health care side.
Right.
And you are a speech therapist.
Yes.
So a lot of times when we think of someone having home health care that is Medicare reimbursed in their home, we think of physical therapy, occupational therapy, a nurse likely that comes and takes vitals and so forth. But we don't often think of speech therapy.
Right.
So tell me a little bit about how your discipline, speech therapy, works in the whole continuum.
Sure. Well, speech therapists, despite our name, don't always just work on speech. So there's several other things we work on as well. That would be swallowing, cognition, language, as well as the speech problems that people may have.
Okay. Well, let's start with swallowing. That seems like a pretty obvious one, that somebody who's aging and maybe had a condition, a stroke, or is, having some other medical issues. So what about swallowing? What are the difficulties with swallowing that you're addressing, and how do you address them?
Okay. So we see a lot of people who have problems with swallowing as we get older. Just the same as our muscles in our arms and legs get weak, the muscles in our throat and our mouth, they become weak as well. There are several different signs that someone might be having trouble swallowing. These include choking while they're eating or drinking or coughing.
Okay.
Having pneumonia repeatedly. It may be because food or liquids is getting into their lungs, causing a pneumonia.
So if they're having pneumonia repeatedly, that's a symptom that there's something going on?
It's a sign that perhaps we should do an evaluation to see if there is some trouble swallowing.
Interesting. Okay. So when you say their muscles weaken and they might have some issues, what is it that you as a speech therapist then can address to strengthen those muscles?
The number one thing that we do right away upon the day of our evaluation is evaluate which diet textures and consistencies are going to be the safest for that person at this very moment. That might mean putting them on a softer diet or a pureed diet. That may mean thickening their liquids so that they run more slowly down the throat and reduce the risk of aspiration. Aspiration meaning when the liquids or food goes into the lungs.
Sure.
And then that's step number one. Step number two is treating the actual weakness. So a lot of times we're doing exercises to help strengthen those muscles. We also have a program called Vital Stim, which I am certified in this program. It's electrical stimulation through the use of electrodes that we put on either the throat area or the facial area, depending on where the problem is. Those electrodes deliver an electrical stimulation that actually make the muscles contract. And by doing that in combination with eating, drinking, or exercises, we can actually strengthen those muscles.
What does that feel like when you put it on your neck or your
different
chin?
people describe it differently, but it generally feels like kind of a pins and needles type of feeling. It's not too painful, although there are people who have different tolerance levels of it. Some people
it's not it's not like getting a massage.
It's not like getting a massage, but it's also not like getting a shot.
Right.
Okay, so it's somewhere in between there.
So it's this little tingly maybe thing to, like you said, to stimulate.
Right.
What does it? Can you describe what it looks like? I realize you weren't able to bring it.
Sure.
But
It's
is it scary looking or?
No, not Not really. The electrodes are just like the sticky things like you see on TV, like on the hospital shows.
Okay.
So usually they're in sets of 2, and they're on the same adhesive sticky piece. So we put one strip here, or there's different placements to use.
Okay.
And then they're just going to have simple little electrical leads to a small box that's about this big, and that's all there is to it.
Okay.
I mean, it's battery operated, so we don't have to plug it in or anything.
Interesting.
So it's handheld.
And you are certified to do this, and not anyone can.
Right, exactly.
Right.
There's a lengthy training course to go through before you can become certified.
Interesting.
Yes.
So do any of the other exercises that you do for swallowing, do they involve singing or sounds or?
At times, yes. Actually, there are exercises, because it is the same muscles that we use for swallowing that we use for speaking. There are actually some exercises involving the voice. So we may have patients say ah or e, different sort of singing type exercises like that.
Okay. Do you work very much with the music therapist then? I know we've also had the pleasure of having Great Lakes Caring music therapist on the show, and I wonder if you work with her.
We haven't in the past, but that's an interesting concept, and maybe we'll need to explore that in the future.
Yeah. Speech, it's in and of itself is a very kind of interesting and such an important part of who we are, and how we identify ourselves. And I know when we think of speech therapy, most of us think of, or at least we used to, about having speech therapy in schools, right, with children. Did you ever work with children?
I did, mostly when I was in graduate school.
I see.
We, as part of our training at any speech therapist or most speech therapy programs, would have training at adult level as well as children. So
what led you to the elderly population, the geriatric population, as opposed to children?
Well, one of my very first classes was an introduction to speech language pathology course, and we had a woman who came in who had had a stroke, and she was a music lover. That was what she did.
How old was she? Elderly?
She was younger. She was in her 60s, I would say. So to me, relatively younger.
Sure. Yeah.
But she had complete loss of both her understanding of language, her speech, as well as her ability to read music. She had lost everything. And she had worked with speech therapists, and she actually had gotten into artwork as a form of therapy and painted pictures to help express her feelings. And gradually she improved dramatically, I mean, from having completely no language at all to being able to at least come up in front of our class and talk. It wasn't perfect, it wasn't 100%, but it was so much better for her, and her life had gotten so much better from when she first had the stroke that I just thought to myself, that's what I want to do. I want to help people be able to go from nothing to be able to talk again and express their
some
feelings.
Of their, right?
Yes.
Because with children, you're trying to help and prevent ongoing issues and problems, right?
Right.
But with the elderly, you're trying to regain
what they already had.
Wow, that's a powerful story.
Yeah.
Yeah, and that's when you were in, did you say you were in graduate school?
No, I was in undergrad at the time, so I think it was my sophomore or junior year in college.
So tell us a little bit about your background and your education. Where did you go to school?
I went to Michigan State University, both for undergraduate and graduate school. I loved it there. I did multiple different internships during my graduate school experience. At schools, I actually did in a home care setting, but it was for children. It was with the early intervention program there in Lansing, as well as skilled nursing facilities and outpatient hospital setting.
Okay. So you're kind of unique at Great Lakes Caring because you kind of straddle both the home health care side, which is really working on a goal to improve someone's condition, as well as the hospice side, which the goal is to keep comfortable
Right.
at end of life.
Right.
So and you're one of the few therapists who gets to straddle that, right?
Right.
So talk about that.
And
That
it's
must be
not all that
interesting.
often, but we do occasionally get called in to the hospice side when a patient may be having difficulty swallowing. Maybe it's a new problem or a worsening problem. Or on the opposite end of things, perhaps they've been on a pureed diet for a very long time. They really don't like it, and we want to make their end-of-life experience as comfortable and as pleasant as possible. So maybe they are at a point in their life where they can be upgraded to having some soft, solid textures. So they call me in, and I do an evaluation for swallowing. I may do a couple treatment sessions afterwards to follow up. But yes, like you said, you put it perfectly. We're trying to make them as comfortable as possible. We're not working to fix a problem.
Right.
But yes, we do.
Yeah.
It is a unique position to be in where I do get to see both sides of things.
It must be very gratifying for you,
Absolutely.
Kelly. Yeah, both sides. I've been through both sides with my parents. Lots of home health. They did not have speech therapy. Well, actually, my mother did have speech therapy after leg surgery. And hers was really related to dementia. They were really trying everything, physical therapy, occupational therapy, and speech therapy.
Right.
And I remember I was a little unclear as to why. Of course, I didn't want to turn down the therapy or the help, but I didn't understand the reason why she was prescribed speech therapy at that time when she could speak well enough. She just had cognitive issues. And you mentioned that earlier, that cognitive issues are among the issues that you deal with. So
Absolutely.
how does that work?
Well, the main issue with cognition that people think of most is memory. Now, a lot of times that is involved with a lot of other issues as well in cognition. So, but memory is the big one because that's what everybody's talking about. Everybody is afraid of losing their memory, is worried when they begin forgetting things. And of course, part of that is normal in the aging process.
Sure.
When it gets to be a little bit more forgetful, then we start to think of things like dementia and Alzheimer's disease. So what we do to treat those things are different exercises that can help to sort of activate the mind. I like to think of the brain as another muscle in our body. So just the way our legs and our arms become weak if we don't use them, a lot of people, they stop working. Eventually they may stop communicating as much with family and friends because they aren't able to get out as much. The less we use our brain for those types of social situations, the harder it is for the brain to remember how to do those things. And so I like to, talk to my clients about mind-stimulating activities. So those things might be like doing puzzles, crossword puzzles, word games, word searches, card games. They don't have to be, it doesn't have to be like a homework assignment. It can be fun things, but just things that are going to activate the brain. Even watching TV, if it's, something interactive like maybe Jeopardy or, something like that. Or the news, reading the newspaper is a great mind-stimulating activity.
Yeah. You mentioned reading, and earlier you had said that may be one of the things that you use during the session.
Sure. We do a lot of paper and pencil activities, like you would maybe find in school. But so reading, having the patient read a worksheet and write the answers down, those types of things. As well as using those techniques, such as writing things down to help the memory. So a lot of memory strategies are really common sense, like using a calendar, writing down important information. But sometimes it's hard to admit that yes, I do need to do that on a daily basis, or else I'm going to forget these things.
Yeah. What, it may. One question that I have, and I'm thinking others may have too, is how writing is related to speech. So if you're having somebody write things down, I understand how it could help memory, but how does it necessarily help speech?
Well, it wouldn't necessarily help the speech unless, perhaps they're having trouble communicating. And I think what you might be referencing is language.
Okay, okay.
Speech therapists will differentiate between speech and language. Speech meaning articulation and how the words sound when they're coming out.
Right.
Language being more how the thought in our head becomes speech.
Or becomes something that you can communicate.
Right.
Whether it's speech or written.
Right.
And you deal with both.
Exactly.
Okay.
Exactly.
All right. That does make a lot of sense. So what are some of your favorite activities to use? Let's just pick kind of a scenario of someone. In fact, I actually have a situation that I could tell you about. One of our clients at Bright Star, which is private duty home care, recently had a stroke.
Okay.
And her speech was affected. She speaks well, and then all of a sudden she goes into this really raspy whisper, and then she'll kind of come out of it. Have you ever had a situation like that, and how might you tackle something like that?
Okay, so I have. Obviously, I'm going by from what you're telling me. You haven't done an evaluation.
No.
So that could be a problem with a few different things. It could be that she's having some dysarthria. That's the word we use to describe basically slurred speech. What I would do to treat that is probably oral motor exercises to help to strengthen the structures in her mouth and her throat. Also articulation tasks like reading words or sentences to try to get those sounds sounding the right way and get the mouth to make the movements in the mouth the correct, precise way to make the words sound right. She also could be having trouble with voice. A lot of times what we see is somebody who has a stroke may have a paralyzed or partially paralyzed vocal cord, and that could be making that raspy, breathy noise when she speaks. So, and also another thing that we deal with a lot is breath support. Sometimes people just forget how to support their voice, or they need a different level of support for their voice because of a breathing problem.
Right. Or how maybe to breathe while they're speaking, right? Because a lot of people, I know in voice lessons, my daughter takes voice lessons, and one of the first things she was taught was, don't hold your breath while you're singing. You have to breathe while
use the diaphragm.
Yes, there's really is a lot to this, isn't there?
It's
much more complex than we might think. Do
Mm-hmm.
you work with families? Are you able to train family members to do much of this and keep it, alive while, between your visits?
Absolutely. I think that's one of the greatest parts of working in home care is that we do actually go into the person's home. We're in the environment that they are at most of the time. We're with the people that they're with most of the time versus being in a facility or in a hospital where, they're so out of their element that, it makes it a lot harder. So working with the family members is one of our key, components of our therapy.
Yeah.
So we're training those family members to help the patient use those compensatory strategies that we talked about, or help them do a home exercise program that we've set up.
Yeah.
Without that, there's, we're only there a couple of times a week. So without the family helping to support that, a lot of times we don't see the carryover that we'd like to see.
Do you have a favorite success story?
I do. I've got several. I have several. There was one woman I'm thinking of in particular who she lives in an assisted living facility, which is another. We go to anywhere where the person considers their home.
Absolutely.
So assisted living facilities are also one of our, places that we go. This particular patient had just moved in to this facility, was having a lot of trouble finding her room and getting used to the new routine of things.
Yeah.
You know, she wasn't at her home anymore where she had lived for decades.
Sure.
Her husband had recently passed. So it was a big change for her. And the family was just, you know, at their wits' end. They didn't know what to do. The facility staff even just, you know, they're used to dealing with new residents, but still, you know, it's very difficult when a patient becomes agitated because they're scared and everything is new. So, and some of the things that we were actually able to do were like to put a sign on her door so she knew which room was hers.
With her name.
Simple as that, yes.
Yeah.
But a visual cue so she did not get lost trying to find her room.
Yeah.
And then we practiced going back and forth between her room and the dining room or the activities room. You know, helping, of course, you know, over time she's going to get used to the routine a little bit more, but just kind of helping with that, setting up a calendar in her room so she's not thinking, oh, I don't know what day it is, I don't know what month it is.
Did you actually have her cross off the days?
I always tell my patients to do that. It doesn't always happen every day, but whenever I'm there, I try to catch up if I need to. And then another thing I always really recommend to the families is to bring in picture albums and label the pictures with the people's names. Because, you know, a lot of times people bring in pictures, but if they don't have names on them, you know, it makes it very difficult because the patient is upset if she can't remember the names. And I don't have any way of verifying if the names aren't there.
Right. Excuse me, there's the the issue. I know this was with my own mother. She would take a picture, you know, we'd show her a picture of somebody and she'd say it was someone else.
Right.
And then we would correct her and then she'd get upset.
Yeah.
So, you know, looking back, of course, I would have done things so much differently if I had more information at the time. But yeah, I could see where putting a name or even working on putting the names with them, right?
Right, absolutely.
Having your elderly loved one say who's there and then making the label and maybe taping it to the picture at that time. And then if you don't agree on who that person is, I don't know, what would you suggest? Maybe go back to it or put the name that she says? Or
Well, yeah, I'd probably come back to it later.
Yeah,
you know,
yeah.
No sense arguing over something. You know, it's very difficult. It's, you know, a lot of times, you know, what we see is as people get older, you know, people say the circle of life. Well, it is almost like a toddler stage at sometimes.
It is, isn't it?
And it's, as you know I have a 3.5-year-old, so I
do
know
you? Yeah.
it's very difficult to argue with a 3.5-year-old. Well, it's also very difficult to argue with somebody in their 80s or 90s who has dementia.
Yes, it is. And not only that, it's counterproductive.
Right.
Yeah, it really is. How much do you use music yourself?
You know, I wouldn't say that I use it on an everyday basis in my therapy. I know there are lots of ways that speech therapists and music can tie in together, especially when talking about voice. I did take a course in my graduate school career that was actually taught by an opera singer, and it was about vocal hygiene. So I guess probably myself, I know a little bit more about singing voice and how it relates to speech therapy.
Interesting.
But there are techniques, I mean, even just for, you know, people speaking on a daily basis that don't use their voice for their profession necessarily. That can be really helpful in speech therapy. And like you mentioned, the breathing and, you know.
I would think that people would enjoy music or singing, not just listening, but actually there might be some that actually enjoy singing. And can that improve their speech, their vocal ability? If it's impaired?
It can. For voice especially, I would say. But you just reminded me of another client I've had who had a stroke, and she had some problems with her speech. She had trouble coming up with certain words. But she could sing. She could sing the words to any song, any familiar song that she knew. It's just amazing how our brain just stores music in a different category, in a different part. And so a person might not be able to talk to communicate, but they can sing a song.
Yeah.
So I always thought that was really amazing. And so I do use it in patients like that just because it's like, I get to hear your voice. You can't talk to me, but you can sing me a song.
Yeah, isn't that amazing?
It really is.
It is one of the true mysteries of aging that has me so incredibly fascinated. Yeah. Well, we've got a few minutes left. Tell me just a little bit about Great Lakes Caring and where your services are available.
Sure. So I work for Great Lakes Caring Home Care, and like you mentioned too, we also have hospice and palliative care, but I mainly work in the home care segment. I'm in the Clinton Township branch, and we service Macomb County and all the way up north to Port Huron area, and as far west as about like M53, so Van Dyke Expressway.
So really a big
we
area.
Do use, yes, absolutely,
Macomb
a very big
County,
area.
some St. Clair County, some Oakland County.
Yes, but definitely, absolutely within the company. You know, there's other branches nearby.
Yeah,
so
and Wayne County, of course.
Right.
Yeah.
Right.
Okay.
Right.
Well, Kelly, thank you so much for joining us.
Thank
You're
you for
just
having me.
delightful, and I'm sure you make a lot of difference in a lot of people's lives.
Well, I hope so.
That's a wonderful thing. So thank you, and God bless you.
Thank you.
Okay. Well, we've come to the end of another episode of Aging Well in America. Please continue to send your ideas for shows that you would like to see here at the Grosse Pointe War Memorial. Thank you. We'll see you next time.